Welcome to the early translational funding panel. These series were started a year ago, and they were called, what is it, Commercialization and Innovation series.
Commercialization.
Yeah, it was just too complicated. And so we came down to Bench2Market. And I think that's a good title, and hopefully we'll stick with it forever. And these talks are recorded, so at any time, for those people who are online, you need to access it. It's on the website through which you registered for the event. Today we have wonderful panelists. Lee Heron from the GRA, Shauna Khoury from Biolocity. She'll talk to you about Biolocity a little bit. Connie Castillo from ATDC, who will talk about SBIR, and Barry Etra, who will talk about Kairetsu. I am Gayatri Srinivasan. I am the only one from Emory, and I am moderating the session, so please bear with me, because my questions may be a little bit tedious at times. I would like you to, So for those of you who are online, you can see the names of the people in case you didn't hear me clearly. I would like the panelists to briefly introduce themselves, really briefly, so that we can continue the actual meat of the session. Shoshana, do you want to start?
Introduce our organization?
Yes,
Okay,
both.
cool. So I'm Shauna Khoury. I'm the director of Biolocity. It is the next generation program built on the success of the Coulter Translational program, which you guys might be more familiar with. We bridge the gap between university innovation, proof of concept, and startup formation, fundable startups, and licenses to industry partners. We do that through education sessions like this. We do it through funding alongside our colleagues at the Georgia Research Alliance. We often partner on projects, and then our launch program, which is where we have active project management, as well as integration of business operational expertise into faculty labs to create this multidisciplinary unit, which executes a specific translational scope of work. And that's been a very successful model for us for the last 5 years.
I'm Lee Heron. I'm with the Georgia Research Alliance, and I work in one of our 3 programs. The one program that's relevant to this session this morning is called GRA Ventures. And in that program, we work with the research universities in the state, and we're included, to identify technology with commercial potential, and we apply resources, financial and otherwise, to a series of grants and loans to help realize that potential. Our grants are to the university. We typically get involved at a very early stage, prior to company formation. In fact, our preference is to get involved before company formation, usually at about the stage of proof of concept or soon after proof of concept. And then through a milestone-based program, we provide additional funding if it's appropriate. A startup is formed, and then we can provide loans up to $200,000 to a startup company spinning out the university. Our programmatic funds are provided by the state of Georgia, and with a goal of creating jobs for Georgians to formation of startup companies. So we've been doing this for over 10 years now, and we take a lot of risk. We have a lot of failures, but we accept that. Our goal is to convert uncertainty to risk and manage that risk.
Hi, I'm Connie Castillo, and I'm with ATDC, which is the Advanced Technology Development Center, and we are a technology business and entrepreneur program for any technology startup in the state of Georgia. Our mission is to help launch, grow, and scale technology businesses. I specifically manage the SBIR STTR program there at ATDC. SBIR is Small Business Innovation Research, and STTR is Small Business Technology Transfer. And those are 2 federal programs that provide federal R&D money to move technologies from lab to commercial product, help commercialize technologies.
I'm Barry Etra, and I run a couple of things. One is called the RAISE Forum, which is run here at Emory Business School, and that is an endeavor to try to fund more companies in the Southeast with Southeast money. But for the purposes today, it's the Keiretsu Forum, which is the world's largest and most active angel investor organization. And both RAISE and Keiretsu, once you get past talking to these nice people, then you come to us because their money is better than our money because most of the time you don't have to pay it back. But Keiretsu, especially on the East Coast, has the ability to fund early stage life science companies, sometimes years from revenue. And that is money that is very difficult to find, and especially difficult to find except for a couple of pockets in the world.
Thank you so much. I'll start with the question of what is an early stage technology? Because I think different people think of early stage as different things. So at university, we think of early stage as preclinical work. So I would love to hear from you, what you define as early stage when you think about early stage funding?
I think every funder will define the stage before they fund as early stage.
Exactly.
So for us, what we look at are academic stage assets that typically have a certain amount of proof of concept already complete. Maybe you've gotten NIH funding, maybe you've gotten some GRA funding. And so early stage by industry and fundraising standards are traditionally maybe late stage by academic standards. Systems will characterize those concepts. We might have a different perspective on that, given their risk profile.
Yeah, we do take a lot of risk. That said, we're looking for technology that is beyond the idea stage. Typically, there's some data, usually in the lab, sometimes in a relevant animal model, as pertains to life sciences. Keep in mind, our purview is everything from aerospace to zebrafish. That said, our portfolio is probably 70% life science. But we typically get involved when it's beyond the idea stage. Usually an invention disclosure has been filed with the tech transfer office. Provisional maybe has been filed, maybe not. Provisional being the initial, it's a holding place, that's all it is. Establishes a filing date for a patent application. But and we're fine with that. To get involved, we probably get involved earlier than just about any other group up here. And our funding is such that it's not a prescribed amount. There is a maximum amount. For instance, our phase 1 grants are capped at $50,000, but we may spend $5,000 on a phase 1A just to repeat a proof of concept study, something like that. It really varies. I think another, as Sean alluded to, and Geiger also, there's a lot of discussion about what constitutes early stage. With venture capitalists, with academic funders, with it, you're going to get, in fact, you could talk to 10 people about what defines early stage technology, and you're going to get at least 20 different things. And that's, in general, sort of the case with early stage, commercialization of university technology in particular.
Anything that's not commercial is probably the only common thread one.
Yeah.
With SBIR and STTR, they are looking, it's federal funding, and there are actually 11 agencies that participate. And each agency has a different definition of what they want for a phase 1, what they say, feasibility study. But for the life sciences in particular, it could be the National Science Foundation, could be the National Institutes of Health, could be NASA because of the astronaut and human health component there. It could be the Defense Department or something, maybe a medical device that has been, you have a prototype of it, you've been working, you've gone through clinical trials, but you haven't actually had it rolled out and tested in the field per se. But for the most part, we look at technologies that are beyond basic research, that are beyond discovery. These are going to be more application. How can you apply the new innovation to an actual product, something that can make you money as a company? Because again, SBIR is for businesses. So once you've crossed over into I want to do commercialization via a startup company, then this might be appropriate.
And for Carezzo, I think early stage is a lot farther along than in the other examples. You really must be able to answer a whole bunch of questions to turn your idea into a business. And if you're not there yet, then you're still back over here. You really got to be able to. There are 9 things that every investor has to know about you, and when you have to know how to do before you are able to actually go out and request money. I mean, simply, quickly, what's the problem? What's the solution? Why does there need to be a solution? How do you turn it into a business that makes money? How much do you need to do that, and what's it going to go for? A little bit about your team, a little bit about the competition, a 3 to 5 year very simple pro forma, and then an exit strategy. Once you have that, you are actually able to go out into the world and raise some money past these.
So, different startups have gotten money from different, or investments from different means, right? So is there a particular startup that gets, is there a way, a particular idea or technology gets a particular kind of funding? Is that defined, or is that not defined? Is it defined by the person who's generating the idea or the ideas? So if you can just give me a little bit of clarity around what makes.
I can tell you on my level, it's usually defined by the investors.
Okay.
The investors, I went to a healthcare meetup over at the Atlantic Tech Village about a month ago, and it was also about healthcare, people invested in healthcare. Unless you're a healthcare IT company, nobody in that panel is investing. There are very different segments, and each of them has their difficulties. I will let these people speak about it because they know better than I.
I guess I was saying that since there are 11 agencies, they're all different, and what they are looking for can vary. Some agencies, they come in, SBIR and STTR come in the form of grants and contracts. So not all money that comes from the federal government is grants. The granting agencies, like the NIH, they are actually both. They have contracts and grants for SBIR. And when they have grants, it's investigator initiated, and you come up with the concept, and it fits within a mission of one of the institutes at NIH. For NSF, they might have biomedical technologies and anything that fits in that broad category. But if you get to the Defense Department, maybe the Army needs a way to conduct blood transfusions in the field, and they will give you a very detailed description of what they are wanting, and you must answer what they are asking for. But that there's potential that they could give you a purchase contract at the end of the SBIR award, because you're basically creating a custom solution to a problem they've had. Versus the granting agencies, you are defining the problem and the solution and the potential customer for that problem.
With regard to our funding, we're agnostic regarding the specific discipline or area that's going to be funded. As I said, we're aerospace and secret-based. That said, there are certain things we look for. Number one is the technology. Can it be protected? In other words, is there intellectual property around that? And we define intellectual property very broadly. It includes not only just patents and patent applications, but copyrights, trademarks, know-how, show-how, anything that could be considered a source of competitive advantage. So we're not limited to just any technology related to intellectual property, just patents and patent applications. They also, in the life sciences area, beyond health IT, it usually takes a lot of money if not $100 million plus, to develop a technology from, from the lab, from the bench to the marketplace. And that typically requires, it's somewhere along the way, institutional venture capital. And there's three critical components. One is technology, the second is management, and the third is money. And the technology has got to be sound. Typically what investors, the folks that are willing to write checks, are looking for is, it's an overused term, but if not world-class technology, but certainly continent, class technology, something that is potentially, again, it's an overused term, very disruptive. It is not going to be Me Too technology. The management, that falls into the category of, because this is complex business. It's not easy. The chances of failure are much greater than the chances of success. So most investors and people looking for money are looking for a management group, including the scientific team, the execution team, which many times is, includes business folks, for lack of a better term, that have been there and done it, or have the potential to do it. And then the third is money. And money follows. I think that's an important thing to realize. A lot of folks think that, well, if there's a source of money, everything else will come. That's not the case. Smart money always follows, meaning that you typically need to put together the technology and the team, or at least the basis for the team first before money comes in. So those three ingredients are critical. That said, the management's probably the most critical, and there are horses for courses. The startup management team is rarely the team that's going to take a drug. The team that goes from a preclinical asset to a phase 1 or 2A clinical asset is rarely the team that's going to take it into phase 3 and through, if we're talking about therapeutic products, phase 3 clinical study and a product launch, or a significant deal with a major pharma, for instance. And that's part of the life cycle of just a biotech company. So, and we play GRA at the very earliest stage.
So I'll take maybe an orthogonal approach to the answer. So based on the stage of technology development, how much money you're looking for, if you're a company, if you're not yet a company, there are different sources of capital that might be a good fit for you. So how much of it is driven by the interest of the future founders of the company, and how much of it is driven by investors? There's certain things that are within the control of the founders. For example, if you're not interested in a liquidity event, if you want to sustain your company for the next 20 years, you're probably not a good fit for any VC that comes to mind for me, right? So because they're interested in liquidity, they have a fund, they need to get that money back. So if you're not interested in selling your company, maybe look at angel investment or bootstrapping. If you're not yet a company, then it's a really good time to look at some of the non-dilutive resources that are available to you while you're still an academic stage asset to de-risk the technology as much as possible. That's where Lee and I come in. And there's a few other pockets of money here and there that you can tap into. The Emory has a great navigator site. If you're over here at Emory, it's actually probably a good resource for folks at Georgia Tech too, if you're joining us virtually. So I'll plug that. That just launched, and that'll help you navigate some additional early stage resources. If you're not raising more than $2 to $5 million, you're probably not a good fit for venture capital, because they want to put in a certain amount of money. If you're before that, if you're maybe raising 500, maybe 1.5 million, go hit a Berry, go to Keiretsu. That's where industry side. Go to an SBIR. And so all of these things are aspects to think about when you think about the funding pipelines, the continuum of funding that you'll need to get your product to market.
Yeah, and that's a very good point. So it leads to the aspect that if we are seeking funding, first of all, we need to have a funding strategy of when we are injecting what kinds of funds. And so that leads me to also ask the next question. Outside of the funding strategy build-up, you should also know every ask that you make has a timeline. Like you ask today for something that's going to come in a few months or a few years. So what does that mean for you today? So I would love for you to reflect on what your thoughts are in that space.
So I'll start. So our timeline is is longer than these and a few others, but that's so our RFP is going to be coming up at the end of October. 2-page pre-proposals will be due in January, and then our funding decisions will be made in May. Funds released in July. So that is a little bit of a longer lead time. However, it's a very dynamic application process for us, and you start getting commercialization resources in the form of coaching, regulatory strategy, reimbursement strategy, all of the, help get all the ducks in the row before we give you the money, so you're ready to hit the ground running. And so that's the timeline for us, but something to think about if you're thinking about, well, I need to launch my company in February, that's probably not necessarily the best fit for you.
Yeah, just consistent with Shauna's answer, our program has a rolling submission. You know, we recognize that innovation takes place year-round. This is just the way we've always done it. So we typically review proposals on a monthly basis, and it's an iterative process. We have a templated submission, you know, maximum of 10 pages. We review. Typically, we're not gonna approve the first time we review it. We get back to the faculty member with one of 3 answers. Either it needs some additional work, some additional clarification to put it in fundable shape, and we either will meet with, and we typically are dealing with faculty at this point, faculty members, the team, or it's ready to go as is, and that's a little bit unusual. It maybe apply to folks that have received previous funding so they know what we're looking for, or it's just not fundable. And in that case, we always provide feedback and say, this is not fundable, and this is why it's not fundable. And many times it's not technology related. It's that there's not sufficient technology mass around which you can build a startup company. Keep in mind, our job is to create jobs for Georgians through the formation of startup companies. And you've got to have a certain market size, you know, that can be related to technology mass sufficient to generate, you know, that market size. So that's sort of our process. Another point, just to take a global view, I think another way to look at this question is, when's the right time to pull the trigger on incorporation? And one of the biggest issues, not to say it's a problem we see, is the tendency to incorporate too early and to look for outside funding too early. And I don't know, Barry, if you see this, but there's a tendency for companies to rush to incorporate for whatever reason, and then to start looking for money. But they're not fundable because they're typically too early. They don't have the right team together. And there's, you know, they're not talking to folks. And if they're not funded within a certain period of time, those companies typically join the ranks of the living dead, meaning they're just not fundable. You can make progress and go back to funding sources a year or 2 later, and even though you might be fundable at the time, you're still part of the living dead. You've been seen before.
Yeah, credibility.
Yeah, and so that this funding strategy is critically important. Some areas are very hot, and you can fund, you know, based on some solid preclinical data. Immuno-oncology is one of those, has been, particularly novel approaches to, let's say, CAR-T and immuno-oncology. Those are pretty hot right now, and have been for probably 2 years at least, 2 to 3 years. Medical device technology, on the other hand, many times, not only does it take, demonstration of proof of concept in an animal model, it takes, human data if that's required, and revenue generation to prove that, number one, you can sell the product, it's going to be reimbursed, people will pay for it, or an investor will pull the trigger on a funding event. So it is very, it's required to know that market and develop an appropriate funding strategy. I mentioned the tendency to incorporate too early, which relates to the SBIR program. If you want to apply for an SBIR, you typically must incorporate. The reason being, to apply for an SBIR, which is often done at an early stage, requires a federal tax ID number. The only way you get a federal tax ID number is to incorporate. So you're caught in this catch-22. You've got to incorporate and get a federal tax ID to get the SBIR, and then you're still early. The smart thing is use that SBIR funds, use GRA funds, other sources of, as Shauna said, non-dilutive funds to mitigate risk, take as much risk out as you can. Then at the right time, depending on market appetite and that sort of thing, then go look for whether it be institutional venture capital, angel money, then go look for those funds. Once you use those funds, you've sourced them elsewhere, you mitigate the risk.
But one thing to keep in mind is also the long lead times with SBIRs.
Yeah.
That's what I was gonna say. There are, it's part of your funding strategy. It's not a quick fix money. I would say that from the time you actually submit a proposal to the time you get notified they're going to get an award is 4 to 6 months. However,
And that's fast.
and that's, it depends on the agency, but they're trying to get that faster, but I wouldn't bank on it, any sooner. If you get it faster, then it's a surprise. But there's a lot of lead time before you actually submit your proposal that you need to be prepping, and you need to be understanding your business. Unlike what Shauna was saying about having and rolling, and Lee was talking about rolling deadline, there are deadlines for SBIR. Some agencies have multiple deadlines per year, but some agencies, like I was talking about with the health, you have NIH, which has 3 major submission deadlines, and then some other ones throughout the year for special topics. But the major ones are 3 times a year. The National Science Foundation has twice a year, although they're trying to go to more of a rolling submission. If you go for the Defense Department, they are up to 5 times a year, but there might or might not be a health or medical related technology topic in there for each one of those. And then if you're going to do NASA for astronaut human health, they have 1 submission per year. So if you miss that deadline, you have to wait another year. So, and while you're working, you do have to be a company, which means, it can be on paper and not a functioning company, but it still must be registered, and you have to have documents. And when you submit your proposal, you have to convince the reviewers that you really are a company and that you're not an academic continuing your academic research, but there is a market and you have a means to get it to market, or at least a plan to get it to market. So you will be judged on your team, not only the PI, the principal investigator, from a scientific technical perspective, but they want someone just as, if almost as credentialed on the business side, or who understands the industry, who could actually go out and start raising money if you're successful, or start getting some beta customers or some pilots, someone along those lines. So all of that takes a lot of time. If you haven't gone through NIH or NSF has one, the I-Corps program, or some form of customer discovery, customer identification to actually find out if there really is a market, I highly suggest you go through that before you write an SBIR proposal. That'll give you more information to include in your proposal. But all this to say that it's the government's timeline, so it's not going to be fast, but it does help, as Lee was saying, it helps de-risk your technology, so that then when you go to an investor or angel, that you can go in with your technology further down the pipeline, and it helps you with your valuation, getting a better valuation.
So real quick, just jumping on the federal funding resources. So Biology is one of the newest additions to the BARDA Drive Accelerator Network. So BARDA manages the strategic stockpile for the U.S. for public health emergencies, so medical countermeasures, things like that. They have a new EasyBAA It's essentially a 3-page application to apply to them. Their turnaround times are a month.
Oh, wow.
Yeah. The BAA is currently not open. It's the new fiscal year, so they're waiting to see what their budget looks like for
And it's
Congress.
rolling?
And it's rolling. And so if you're interested, if you have technologies that are in the area of specifically pre-symptomatic disease detection, sepsis-related technologies, host-focused sepsis-related technologies, not necessarily pathogen-focused, or something that's truly transformative for U.S. health security, please visit our website, request a meeting. We are very interested in helping you put together a very on-target proposal for the BARDA Drive program.
Awesome.
Just add a little to what's been said before. We've all these things are valuable because in the non-life science long tail world, if you can go get sales and customers, you've proven the product. Well, that's not really available here. So the more of these things you can get, from the NIH grants, the SBIRs, the PPRs on forward, the help from these things, from non-dilutive money, that's almost the same way of saying, yes, this has been recognized, this is what you want to look at, and that gets you farther forward. That said, our process essentially is application online. Within a couple of weeks, you can get to a screening meeting for the East Coast. It's in Philadelphia. If you are one of the top companies in that screening meeting, you then get invited to due diligence. Correctly, that's done by the members. That I tell people to allow at least 2 to 3 months for that to get done. And then you can, once it's done, you end up with a packet like this thick that you can take anywhere.
Mm-hmm.
And then it's still a few months because you got to go around and ask for checks. But it's not a year, it's quicker.
But from the entrepreneur side, how long does it take to raise, let's say, $1 million angel round or $500,000?
Again, it's all it all depends on how lucky you get.
Mm-hmm.
There's not enough money. I mean, there's enough money 3 places in the country: Boston, New York, and Silicon Valley. But that's 80% of all venture funding, small V, in the United States. So it takes a while, not only to figure out how you're going to ask for it, what makes it compelling, and then getting to the people who understand it and will help fund it. So it's you almost have to always be funding until the money's in your bank.
I did want to ask specifically around the fact that we are saying for SBIR and STTR, we or some other places, we need to incorporate before we can even seek funding. So now that puts a little bit of a confounding problem for an investigator who's now starting a company. So if he can't do that company work in the lab, so then how do we address the space requirements for such funding, right, or for such work? And what are the solutions that, because I mean, I bring those questions up because that is something that I've been involved in conversations around, so I would love to hear from you specifically. I mean, Connie, how does NIH look at it, or federal funds look at it?
Well, NIH in particular wants you to define where you're going to do the work as a company. There are some incubator spaces that are out there. ATDC does have some wet lab spaces. Other universities have some space out there. But you then, or how are you going to pay the rent until you get the funding? So it's a catch-22 on that. But I would say it's also, you need to look at, before you go forward, are you going to actually, is there enough there to have a business? Look at your innovation, your discovery, and say, is this actually going to be a product, or is it a feature of a product? If it is a feature, then you don't need to be going the route of the SBIR world. If it's a product, is it a standalone product, or is it something that's really going to be integrated in someone else's product? And if it's going to be integrated in someone else's product, you really you just need temporary space really to develop out what you're doing. A lot of universities, if they don't have space for a company, might be able to give you a contract for a certain lab, or give you space for, this is your bench and it has a locking cabinet. As long as you can define that this is your space and it's not shared. You might be having, you pay a portion to use some of the equipment, but it's not like it's your equipment and it's not your lab, but it's your bench within the lab. It's a way that some universities help provide for that. And then there are some private incubators as well, but you're going to be paying for those. SBIR and STTR are supposed to help supplement your research funding, but they're not supposed to pay for everything. So you might have to tap into some other resources to pay for some space until maybe an SBIR or STTR kicks in. Some places have a contingency letter that they can give you to say space can be provided if available upon contingency of you receiving an award. And so like NIH, they usually accept that, but then when you get notified of award, they say before they actually will give you the money, they want to make sure that that has been converted into you actually have a lease.
So may I interject and ask a question? So with regards to the STTR, I think the difference between STTR and SBIR, if I'm correct, is that you can actually still do the sort of the largest portion of the work in the academic setting.
Well, the awards all go to the company.
Okay.
With SBIR, you can subcontract up to a third, but you're not required. The PI still has to be a full-time employee of the company at the time of the award.
It used to be 50, just 51%. I don't know. If it's
Well, that is considered full-time.
Yes.
So that usually it's 51%, or there's a limit to the number of hours you can work outside of the company. But usually that means that you're not full-time somewhere else. With STTR, some of the agencies allow that PI to be full-time at the company or full-time at the research institute, because you are required to partner with a nonprofit research institute, which 9 times out of 10 is going to be a university. But the award still goes to the company. And if you are going to have the PI on the academic side, then there still needs to be a separate individual that is the company representative. You can't play on both sides. But with NSF, National Science Foundation, the PI, whether it's SBIR or STTR, have to be full-time with the company.
So you did talk during your comments about roadblocks, but can we address specific roadblocks that come into play when an entrepreneur asks for funding? What do you envision as the critical roadblocks?
Well, there are lots of them, but to say something that Lee was talking about earlier, rarely today will an incremental advance get anybody excited. It's got to be something more than that. And therefore, there are a lot of interesting technologies that get developed. Tech transfer offices are full of them. But how does it become something that is really addressing a very specific problem in a new and interesting and much, much better way? And what you find, the biggest roadblock for many companies is they start out as one kind of company and then become another kind of company, and finally hit upon the kind of thing that really makes a difference and resonates all the way around.
So pivoting is important, not
Thinking, being able to look at it from point C and say, we're making progress here, but not much. But if we go this way, there's a lot more interest and a lot more advantage.
I would say with SBIR, TTR, one of the biggest roadblocks is that are you really a company? Do you have the business, like your financial model, is it organized? Is it realistic? Do you have someone that understands the business community? Do you understand the business side of, there's a customer, the one that writes the check, there's the user that might be a physician, there's the parent that is all excited about it, but the beneficiary is going to be the child that has the disease. You have to understand all of those in the whole marketplace to be able to get a successful product versus a technology innovation.
you know, if you start with a company that is fundable, that has, you just call it the it factor. It's in a hot area, it's got great technology, that's a proof of concept or later, it's got a good management team, stage appropriate, you know, meaning, I mean, you can take someone out of Pfizer or Novartis or something like that, but the start of a net company is just as likely to fail as someone who starts with an undergraduate student, you know, because going from a big pharma to a startup is not an easy transition at all. It just is not directly relatable. They may know the industry, but the startup world is different. But if you started a company that checks all the boxes and work down from there, as Barry said, there's many, many different roadblocks. You know, that's why it's easier to fail than to succeed, and the ability to succeed is based in large part on the ability to anticipate those roadblocks and to, you know, there are risk factors. If you just take a risk-based approach to this, how do you identify those risk factors and convert and reduce that risk? That's what GRA tries to do. You know, we do that internally, but also we make heavy use of outside consultants. And so you reduce risk to put it in more fundable shape. It may be market size. It might be, you know, the technology is at such an early stage. It may be the regulatory path is uncertain. For a lot of products, particularly on the medical device side, it's reimbursement. Because you can have the greatest product in the world, but if you're on a very long reimbursement path, or you're on private pay, it's probably not going to be fundable. You know, so every project is different, and you have to go this sort of systematic process of looking at the various risk factors and systematically reducing those risk factors. The one thing to pick up on a theme that Connie, you know, has emphasized, the SBIR, the funding organizations look at, is you want to make sure that you have the potential to become a real company. And GRA is the same. We'll fund very early stage projects long before they're companies. You know, but we need to know that they're headed in that direction. One thing we will not fund are hobbies. You know, we don't fund hobbies.
Lifestyle company.
Well, how do you define a lifestyle company? That's difficult. You know, it's just unknown. But that's typically a company that's not fundable. You know, again, keep in mind we're in an industry, biotech, life sciences, it takes outside investment. Lifestyle companies are companies that oftentimes are just not fundable. They don't have the dynamics, the growth potential that a venture fundable company does have, for instance, and they're just not fundable. But we in particular tend to stay away from lifestyle companies or companies that are set up solely for the purpose of generating preliminary data for a R01 or other NIH type grant. We typically don't do that.
There are internal funds in Emory to do that.
Yeah.
I mean, to crystallize it in a way, if you go up to an investor and say, look, I have a great company, which, by the way, every company says they have a great company, and I have a great company that's going to pay you 6% a year for life. Nobody will invest in it. That's not what they want.
Yeah.
They're looking for much greater returns much quicker. So you have to think about it from the investor's point of view.
There are very few companies that where, you know, I don't know how many of you are familiar with Bob Langer. He's sort of a startup guru at MIT. I mean, he started and involved in probably starting 100 or more companies. Many of those have gone on to great success. You know, it's that kind of stature. He can go to a venture capitalist. He does this. He goes to Flagship or Third Rock or Atlas Ventures. They're all based in Boston, you know, which is a very vibrant ecosystem. And says, I've got an idea. I think it's going to work. They'll write him a check right there.
And that's also because a lot of his students are now working those.
Yeah, that's exactly right. You know, but those folks are very few and far between.
Right.
And I think to that end, I mean, so there are roadblocks that you can anticipate, that you can overcome that are external. There's also pretty real internal roadblocks. So if you are the type of researcher that likes to work alone, that has a hard time working in collaborative teams with very different life experiences, different areas of expertise, or if you have a hard time trusting new partners, you're gonna have a hard time commercializing your technology and finding someone to fund you. So it's to circle back on the whole team side of things, it's incredibly important. And these are things that we try to mitigate and try to identify early on in our funding process, because if we think you are one of those types of researchers, you're gonna have a hard time getting our money, probably have a hard time getting Lee's money, and you'll have an even harder time getting there.
I heard so much.
Yeah. Lee and Shauna, I think, said it earlier, you can be an early stage company, but timing, you have to be able to show that everything's right. You have to be able to show, yes, this is gonna happen now. It's hard to get to that spot, but once you get to that spot, you now make people sit up and say, okay, they've done the hard work. They've gotten the hard parts done. They are on this way, and I think I can see a clear path for them through the rest of this process. If you do that too early, as you can say, you can get cooked. You can really, investors have an odd mindset. They've seen you once, they don't want to see you again, despite the fact that you're now much, much, much farther along. So try to make sure you're in the right place.
I would like to give the audience a chance to ask questions. I know Barry has to leave, but please go ahead and ask. Yes.
Now, you said that you won't fund preliminary data to get an NIH grant. Explain that a little
Not
more.
with GRA funds.
Okay, in that you hear people that have an idea, then they have a prototype and say a device, and they have to do a clinical trial. Is that preliminary data? Or
No. What I typically mean is that if the objective in seeking GRA funds is not to ultimately commercialize a product, I mean, that's what we're all about.
Okay.
It is ultimate commercialization, even though commercialization sometimes used necessarily is a not a good word. It's sort of a dark side term. If that's not the ultimate goal, and our timeline is very long. Keep in mind the average time to develop a new drug is probably at least, I think it's 12 years now, 12 to 15 years, and over I think it's $1.5 billion, something like that. So, there's a long timeline, but if it's just to get data to support an RO1 without a view toward ultimate commercialization, and it usually becomes pretty obvious.
Yeah.
We're not going to fund that. That said, many, if not most, of the pure biotech products that we fund, there may be years of NIH-supported work that's already been done, and that's a validating event for the technology. If the NIH, in the peer review process, has invested usually millions of dollars in a technology to get it to a certain point, that's a validating event for us. It's a validating event for outside investors. But if the purpose is simply to get to that point, to gather data to support an RO1 without a view toward commercialization, we're not going to fund that. I mean, we encourage folks to apply for SBIRs. One of the second, we call it phase 2. It's not very original, but that's what it is. Does require a dollar for dollar match from an outside source. We want to make sure GRA is not totally at risk for this money. And SBIRs and STTRs have emerged as the most common source of match. We also count Coulter, I guess now Biolocity funds, as a source of a match, because those are ultimately intended for commercialization. We don't count conventional like RO1 money as a match, because those grants are awarded on scientific merit, not on potential commercial merit.
And if you go for an SBIR, STTR, they're already expecting you to have preliminary data. This is, again, application research to, can it be a product? So it might do some advanced animal studies, and some are allowing to do some clinical trials, and then if you go on for phase 3, quote unquote, phase 3, there's no such thing, but like some agencies call it that, it requires matching funds, which is where we could come into play, and that's for more of the commercialization dollars to help with that.
I mean, I have a question regarding other sources of funds. So, for example, you have large foundations, also big pharma that you can strike partnerships with. Again, as an investigator who's interested in translation or commercialization, the one thing that I find difficult at this point is finding the right legal counsel to approach those partnerships and just talk to people in a way that I know I'm not going to make a bad step with regards to IP protection or those types of things, licensing rights or. So is that that type of support, can we get it through either by the city or GRA? Is there? I mean, right now I'm talking primarily to friends who are in industry, but shall I incorporate and get a legal counsel right away in the company? Like that's one of the questions that I think one of the potential roadblocks that I can see.
So I don't think you can use 3 out of the 4 of our dollars to support a company's legal counsel. So this is one of the gaps with non-dilutive funding mechanisms. This is where friends and family rounds are important, where angel rounds can be great, because there are expenses that the company will incur that are not related to development or commercialization strategy, which is where most of those non-dilutive dollars are focused. In terms of specific individuals, I'm happy to recommend some folks we've worked with in the past, but I'd also be thoughtful about why you're forming the company for the part, like if the foundations are thinking about putting money in, or these big pharma companies are thinking about putting money in, then yeah, maybe it is time to start the company. If it's a partnership or just a collaboration, is the technology really ready to be licensed into your new startup, or is that funding better spent inside the academic sphere? You can incubate a little bit longer, de-risk it more, so that you can get investor dollars in. It's depending on what your technology is, unless those partners can take you all the way across the line.
You could potentially, but then the question is how much ownership do you have in the direction that you want to give to the business or the development of the actual treatment, for example.
And so I will argue that most academic researchers don't want to be in charge of the business. There are individuals who have spent their career in industry developing technologies. Find a really great one of those who understands the operational business side of things, that can set up HR, that can do all of these things. Take your spot on the scientific or medical advisory board. They'll want you involved. They'll want you to help drive the science, but in terms of operational control of the company, sometimes that gets convoluted with 2 things. One, ROI, and the second is risk reduction. So you are better off owning less of the company if you have the right partners and focusing on maximizing the size of the pie. So you're better off owning between 1% and 10% at the end of the day, once you get all the non-dilutive capital in of the company, and having that company sell for 10x, then maintaining 50% of the company, but recognizing 1/10 of the value. It's a really great Harvard Business Review article on this. I'm happy to
I mean, I'm familiar with that. I mean, I think the one aspect that we often sort of fail to consider when we're talking about academic scientists trying to break into business is we still have sort of an idealistic cap on our head where we think at some point the direction, or let's say the patient population that's going to be targeted for a particular type of treatment. If there are several markets that you can hit, you might have an orphan disease in mind, and it might not make sense from a business standpoint at all. And you still want, I mean, that's really one of the things that drives you, right? The operational control is not necessarily a question of money. From the academic standpoint, it could be also a decision-making conundrum. Like, are you going to be able to decide, I want to go in that space?
But that might also be where you make that decision of, do you want to have a company, or do you want to develop the technology so that the attractive
Sure.
that can be licensed from Emory. And
Yeah.
you know that you have contributed to the development of it from, you know, your heart. You know, you helped solve this problem, but you're not a business. So you have to think long and hard, do you really want to be a business? You know, and so if you want to be that business, then those are what Sean was saying, those are things you have to
So I
consider.
can give a specific example. We funded technologies in pediatric space specifically. Small markets, maybe it would be in humanitarian device consumption, or food and drug, and orphan therapeutic. We've done so. The orphan therapeutic industry, there's a business case to be had there, right? And so we've seen folks move forward with pediatric orphan indicated devices that maybe there's a larger adult market upside, but it's easier to get to market in the orphan indication. On the flip side, on devices, we've seen folks get things to market, indicate them for adult and pediatric markets, and they'll get sold into the pediatric market, even if that's not where they're initially marketed, if that makes sense. So you do see things like off-label use and having part of a cohesive, sustainable business model, maximize the probability that technology ever even gets to the patient. Because if there's no business case to be had there, that technology is not going to get there, no matter how virtuous or how there's a ton of unmet medical needs. So there's something a little bit of trade-off.
Absolutely. And the other thing to consider is that when you're licensing the technology to your startup, you can have carve-outs where you can say that, you know, this startup is not going to be interested in the public, the public good side. Let the startup make the money side, and then you can carve it out and potentially have that develop in a different way. So you can. There are many modalities that you can use for your purposes. It's just that you have to consider those. It's good that you're considering them ahead of time than once you're in the business. And I know that. Sorry, do you have one question?
Yeah, I just want to ask Connie, do you tutor people write STTR, SBIR?
Do I write it?
No, tutor with the
Tutor.
PIs.
Yeah, I can help through the process. I'm not a writer myself, but I go through the process and help.
Because I'm still quite confused about your identity. What is your function? Then your
So I'm a coach, I'm a guide, I help, I train, I teach you the process, I answer your questions, I'm a resource for you. That's basically my role.
So my situation, I wrote a STTR, submitted an NCI, get a score, not foundable, first round. So I'm thinking how to revise it at this stage.
Right.
And I hope if you have time, I can talk to you, if you're willing to look at this
I can give you my card or, you know.
And also I blindly submitted one granted to DOD. I didn't know that category actually for commercialization. So I minimally addressed that. So the review come back. Also, actually, not a bad review, lots of good things, but kind of strongly point out that I didn't address that commercialization or what a future that they looking for, because I'm basically a scientist.
Sure, are you glad to talk with me, online?
That's why this year I submitted another one, thinking that one, I just realized that one is not suitable for me. That one, it sounds like fun. I feels like I lack constraints to address those relevant what they want. Also, I didn't know they want that.
So Connie is a great resource for that. Our Office of Tech Transfer has Kevin Lee. He can also help you navigate that process. So I'm happy to connect you. You are at Georgia State?
Yeah.
Okay, all right. All right.
Sure. In road, but happy to talk with you, and there's resources there too.
But let's thank the panelists and for a wonderful session.